Welcome, welcome. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all. Let us start today's interesting video, which is regarding the Ayurvedic treatment for motor neuron disease. Ayurvedic treatment for motor neuron disease (MND), presented by myself, Professor Dr. Rajendra Raghuveer Deshpande. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. And this is my mobile number 9226810630, and this is my mail ID professordeshpande@gmail.com. You can contact me for online medical consultations, online palmistry consultations, private tuitions, or the classes for Ayurvedic students. Please don't forget to subscribe my YouTube channel where you will get all the educational videos regarding every disease. These all the videos are very useful for Ayurvedic students, Ayurvedic professors, Ayurvedic doctors, not only Ayurvedic, allopathy, homeopathy, naturopathy. Everybody is getting benefited and they are giving me the nice feedbacks. Thank you very much. So, general rule, whether you practice allopathy, Ayurveda, homeopathy, or naturopathy, you must try to find out the root cause of the problem, because this is called as a differential diagnosis. In Ayurveda, it is called as a Vyadhi Vyavachedaka Nidan. Also, there is a basic management principle for any disease. If you want to treat any disease from cold to corona, any headache, cancer, digestive problems, Ayurveda says there is Sanshepataha Kriya Yogo Nidana Parivarjanam. So the management principle is try to avoid, try to remove, or try to treat the basic causative factors. That is very much important. Then motor neuron disease, Ayurvedic terms. I would like to tell you some Ayurvedic terms. It can be compared with Sarvangavata, all over the body. Majja Gatavata. Majja is one of the important dhatu in our body. Rasa, Rakta, Mans, Med, Asti, Majja, Shukra. Majja is related with your nervous system, neurons. Then Snayu Gatavata, because it is related with the muscles. So Snayu Gatavata. Vata is a bioenergy which is responsible for all types of movements. Also, here in motor neuron disease, you get the demyelination, covering of the neuron, which is called as a myelin sheath, which is damaged, and that's why it can be compared with Kshaya Roga. Kshaya is a deficiency. Then Avarana Vata. Vata conduction, nerve conduction is get obstructed because of the demyelination. So we have to consider the in the beginning Avarana Vata Chikitsa also. Okay, let us try to understand some modern aspect of the MND, motor neuron disease. This is very dreadful disease. I have seen some cases, not many, but very one, two, three cases, but the death is very dangerous. This is a very crippling disease. Huh? Mortality is there and morbidity is much more problematic. So those who are suffering from motor neuron disease, I have the full sympathy for these patients and their relatives as well. So there is no specific treatment in the modern medicine for motor neuron disease. You can contact to nearby family Vaidya, Ayurvedic or homeopathic doctors, or otherwise you can contact Professor Deshpande, that is myself. Now, this MND, this is slowly the patient get paralyzed. First the legs, then the hands, then all the muscles of the body. Only motor damage is there. Try to understand. Patient can understand all the senses, but he cannot express. He can feel the pinch, but he cannot movement his face. He cannot speak to you. Oh, I am getting pain. That is very dreadful. This is very serious. I pray to the God that nobody on this earth or very unlucky, that because this death is very miserable. The patient remains in the bedridden for many years, and there is no escape from that. I am very sorry to say all this thing. My nearmost friend has died with this disease. We wish that everybody is going to die, I know, but death should be very instant and all of a sudden, like the heart attack. Of course, that also I know that birth and death is not in our hand. I agree full that matter. I am very sympathetic in that approach. But then I will request all of you try to understand this MND, motor neuron disease. Try to prevent it as much as possible. And if you get it, please get the support from the Ayurvedic hospitals, Ayurvedic Vaidyas, because it can little bit improve in the quality of the life. We cannot revert the disease, but we can maintain the patient in a little bit better condition. Okay, this is the purpose of this video. Motor neuron disease, this disease is mentioned in the syllabus of the Kaya Chikitsa subject of fourth year BMS students. So they will be get benefited. Also, the doctors will be get benefited by knowledge and utility in the practice. This disease can occur at any age, but the symptoms usually occur after the age of 40 years, more in the male gender and then the female. The most common type of motor neuron disease, MND, is, what is the name? Can you see the cursor? Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, ALS. There are four or five types of the MND, but this is the commonest, ALS, amyotrophic lateral sclerosis, which is also called as Lou Gehrig's disease. This is the most common. This is affecting both upper and motor neurons. What is the upper motor neuron? The nerve from brain to the spinal cord, that particular segment is upper motor neuron, and the nerve from the spinal cord to the hands and legs, that is lower motor neuron. Try to understand. Affects, what is this disease affects? The muscles of the arms, legs, mouth and respiratory system. A person with this amyotrophic lateral sclerosis will live on an average after diagnosis 3 to 5 years. With supportive cares, of course, some people can live 10 years or more, but that particular living, I am very sorry to say, is miserable. Try to take the help of Ayurveda, homeopathy, in addition to the allopathy. Can you see? This is the cell body, this is the axon, motor. It is giving the orders, move the hand, move the leg. Huh? But here, can you see how thin it is? And so this muscle belly is big, and this is called as a atrophied muscle. The muscle mass becomes reduced. This is normal cell, can you see here? And this is ALS, affected nerve cell and the muscle. Types, another types. I have already mentioned the important type. Another, just for theoretical purpose, for the fourth year BMS students, they must know these types. Primary lateral sclerosis, progressive bulbar palsy, progressive muscular atrophy, spinal muscular atrophy. What is atrophy? Is a shrinkage of the muscle. Use or lose, because the muscles cannot be moved and so they get atrophied. Causes, generally genetic causes only 5%. Familial tendency may be there. Chromosomal defect 21. Some environmental factors, pollution, air pollution, sound pollution, autoimmune problems, toxic, some viral infection, bacterial infection to the meninges, idiopathic, but most common cause. Up till now, the scientists cannot find the exact cause of motor neuron disease. Please try to understand. Definition: this is the group of disorders which gives the weakness and the wasting of muscles. You cannot move your hands, you cannot move your legs, paralysis. But this is important, without any sensory changes. Of course, in some varieties, there may be sensory loss centripetally, graded stocking fashion, as like wearing the stocks. First at the end of the legs and then gradually that sensory loss will come up. Feet have a numb or wooden feeling, as if there is no life, no sensations. But this is very rare. This is very rare. Mainly this is motor problem, motor system problem. Try to understand. So, motor neuron disease symptoms: progressive muscular weakness, patient cannot stand, patient cannot walk, patient cannot move the hands, patient cannot make the sign, progressive muscle wasting, atrophy, use or lose, impaired gait, his walking will be disturbed, limb weakness, loss of leg and hand movements. See my cursor, please. slurred speech. When my friend was detected, diagnosed as a motor neuron disease, he was a doctor. He called me one day like this, I will make some action. Sorry, and with due respect to the patient, मग काय कळत नाही मला असं का व्हायला लागलंय. This is in Marathi. He said, Raja means my name. Please come and see. I do not understand what is happening with me. Slurred speech, dysphagia, difficulty in deglutition, dysphagia, breathing difficulties, symptoms last for many months or years, and prognosis. I'm very sorry, sadhya sadhyatva. The prognosis is not so good. Patient is going to die. So this is MND, motor neuron disease, short form. Difficulty in walking. Can you see? Trip and fall. This is the pathology, normal value. This is the normal muscle. This is thin, this is thick, and this is thin. This muscle belly is big, this is small. Okay. Then leg weakness is there, slurred speech, excessive choking here. Okay. Then what is that? Hand weakness, muscle cramps, ALS patient on the wheelchair, and hydraulic patient lift. When we have to, because the patient is many years bedridden, so you must take some bed which will not cause the bed sores. So there are some water beds are available. Early stage of MND, typical symptoms begin in one of the following areas, either arms or legs, then mouth will come, then the respiratory system. Weakness in the grip, patient cannot hold the cup or the plate, hard to pick up the whole thing. Tiredness, fatigue, muscle pain is there, cramps, twitchings are there, slurred speech. Can you understand? Weakness in the arms and legs, clumsiness and stumbling, difficulty in swallowing, breathing trouble or shortness of breath, inappropriate emotional responses, such as laughing, cannot laugh, weakness of the muscles, cannot cry, facial muscle weakness, weight loss because muscle tone loses their mass. Then the next stage of the MND, early symptoms are as it is remain and become more severe. Another symptoms are muscle shrinkage, difficult moving, joint pain, uncontrollable yawning, which lead to the jaw pain here, changes in the personality and emotional state, difficulty in breathing. Up to 50 and of the people with ALS may experience brain involvement, including memory and language problems. Loss of memory, loss of problem in the language. 15% of the patients will develop dementia, memory loss. They can develop insomnia, loss of sleep, anxiety, tension, and also they can go into the depression. It's but natural. Advanced stage of MND. There they will have need the help to move, wheelchair, ambulance, eating problem, rise tube, breathing problem, ventilator. The condition can become life threatening, the death. Breathing problems are the most common cause of the death. Diagnosis. To diagnose the early stage, it is very difficult because it can resemble many other problems like multiple sclerosis. The symptoms are same. Refer to the neurologist who will take proper medical history, thorough examination of nervous system, and he can do some tests, like for example, blood and urine test to rule out other conditions, not for diagnosis. Creatine kinase, this is the one of the blood content that is more because muscles produce when they get breakdown. Muscle breaking, creatinine increase. Muscle breaking, creatinine increase. Then MRI of the brain can detect the MND, cannot detect the MND. Remember, this is clinical diagnosis. But this can help to rule out other conditions, like whether there is thrombosis, embolism, bleeding, brain tumor, brain structure damage, that can be detected by MRI. See, you can see the electromyography, EMG. The muscles conduction is detected. EMG as a measure of motor unit of activity. These are the different graphs, and doctor can see whether that EMG has been changed. Electromyography, that you have seen the picture, and nerve conduction study. In EMG, amount of electrical activity, how much activities remain. And NCC test the speed at which The current, nerve conduction is going from nerve to muscle, from nerve to muscle. Then lumbar puncture here on the back, and to check the CSF, cerebrospinal fluid, which rule out to other conditions of this paralysis. Muscle biopsy can be taken to detect and rule out the muscular disease. Can you see? Biopsy, a small piece of the muscle has been taken and pathology is detected. Treatment, unfortunately, there is no cure for the MND. Slow down. What we can do? We can slow down the progression and maximize the individual's independence and comfort. We can try. We can try to improve the quality of life. That is why allopathic and Ayurvedic treatment is given for quality purpose, not for quantity. Patient is going to die, but quality can be less pain, less cramps, less anxiety, less depression. Okay, physical therapy to correct the choice will depend which physiotherapy, type of the MND, severity of the symptoms, personal choice, and availability and afford of any particular medicines. That all the four factors are considered and the physiotherapy is advised. How to slow down the disease progression? Some drugs, some medicines in allopathy. For example, you can see the name Edar. Can you see? Edaravone. Edaravone is not commonly used. In America, it is commonly used for preventing muscle cramps and stiffness. This is analgesic, and this is also, I'm sorry, this drug is used to prevent the progress of the disease, but some another drugs, medicines can be used to prevent the muscle cramps. Some medicines can be given temporarily as an analgesic, and some drugs temporarily can be given as an antidepressant. Okay, special devices are there. For example, to comfort for the moving purpose, wheelchair and all these things, crutches, communicating with the others, feeding, rice tube and swallowing, comfort in the breathing like oxygen cylinder, oxygen mask, speech and language therapy in the beginning, help for the communication and swallowing, physical and occupational therapy, which is called as a physiotherapy, to maintain the mobility and function, and encourage people to find the new ways to do their specific task. Now, Ayurvedic management. Preventive, avoid Vata Prakopak Ahar Vihar. Prevention is better than cure. So, after 40, my dear friends, who are the senior citizen, I request, kindly request, please follow, get it your Prakriti prediction done. And what is anti-Vata our lifestyle? There should not be Vata Prakop, Vata vitiation that can damage your brain. So, physical and mental rest, avoid the physical and mental stress, vices, don't take alcohol, no smoking, no tobacco chewing. So, myelination is there, covering can be prevented to get damaged. If you follow this, Ayurveda says this is making the irritation, this is making the dryness in your nerves. Myelin sheath will go off. Myelin sheath will go off because myelin sheath is snigdha, snigdha anchas. So excessive dryness will damage the myelin sheath. Avoid the non-vegetarian food that can cause internal toxins because of the faulty digestion, because non-veg food is always difficult for digestion purpose. That may create, I'm not saying 100%, armor, according to Ayurveda, armor, and that armor can damage your myelin sheath. So understand pathophysiology. So Rasayana Chikitsa is given for Majja Dhatu. I am very sorry for the printing mistake. Can you allow me to correct that? Here the word should be Dhatu. I can save this. Okay, let us save and then again make the screen bigger. Yes, you have to consider the Majja Dhatu, give the regular use of cow's ghee is very much important after the age of 40. Every day, 1 spoon of freshly cooked cow's ghee. Don't afraid of cholesterol. First, you can check whether you have any cholesterol or lipid profile. You can do it. If there is normal cholesterol, normal triglyceride, HDL is good, LDL is low, why to worry about cow's ghee? Don't worry. Be happy and consume the cow's ghee. If you have the dyslipidemia, cholesterol problem, visit to the doctor and consult. He can prescribe medicated ghee which will not increase the cholesterol. Then almonds, walnuts, this is very good for majja dhatu, meditation, huh? Chanting of Om mantra, pranayam, breathing exercises, and Shirodhara. Very good treatment for all the neurological problems. Go to the Ayurvedic hospitals, go to the Ayurvedic Vaidya, do the massage, everything. Then for Mouse Dhatu, Abhyanga is good. Oil massage is very good for muscles. Vata Hara Chikitsa, Majjagata Vata Chikitsa. These are words known to the Ayurvedic doctors, known to the Ayurvedic students. Huh? Avarana Vata Chikitsa and Dhatu Kshaya Chikitsa. Brain tonic is called as a Mejya and Majja Rasayan. In the beginning, Mrudu Shodhana can be given. Eranda Vrishta Haritaki. This is the name of the tablet. 2 tablets at night with warm water or Gandharva Astyadi Kashaya. 6 TSF with equal amount of water before lunch and before dinner. Then tablet Simhanada Gugulu, which contains the Eranda Amapachak, and Rasunadi Vati Lashun to stimulate the nerve conduction with Rasna Erandadi Kashaya. Rasna is a anti-vata herb and that can energizing, also reduce the muscle cramp. Or you can use the Dashamula Arishta, 4 TSF with equal amount of water, Sahacharadi Tail, 21. This is for internal use. 10 drops BD with hot milk. You can see Eranda Vrishtaritaki tablets are available. You can go for this website. Then Simhana, the Gugulu of Baidyanath are also available. After approximately 6 months, Rasarajeshwara Rasa. This particular tablet we can use. It contains Suvarnayukta Rasarajaras 10 milligram, then Shuddha Vishamushti 100 milligram, Ashwagandha 100 milligram, Rasasindur 40 milligram, Gugulu 30 milligram. Dashamula Vishesha Shodhita processed in Arjunarishta. And this is Kakamachi Kwa. So these are all the ingredients of Rasarajeshwara tablet. 2 tablets 2 times a day with Ashwagandha Rishta, good for the tonic of the muscles and the Vata dosha, and Saraswata Rishta, that is for brain. Each Arishtas liquids 4 TSF with equal amount of water. For respiratory distress, what you can do? Kshaya Kulantak Shenduram. This is the company SKM. Kshaya Kulantaka Shenduram. Harta plus Pravar plus Suvarna, gold. Harta is anti-kafagna, Avarana Chikitsa, respiratory congestion, all the slough, all the mucus secretions will be get destroyed or dissolved by Harta. Try to understand. Inflammation will reduce by Pravar and muscles, respiratory system will be stronger with gold. For brain tonic, Chintamani Chaturmukha Rasa, 125 milligram BD. It contains Suvarna, Abraka and Lohabasma, Eranda and Kumari. Kumari for digestion, metabolism process, Eranda as anti-Vata, and these are all Rasayanas for the brain. My dear friends, this is educational video. All are requested to consult your doctor. No self-medication is expected. Thank you very much. Then, can you see? Kshayakulantaka Chenduram. Purposefully, I have shown you this so that you can easily search, especially Ayurvedic Vaidyas and Ayurvedic students can get benefited by pictures. Vaidyanath Chintamani Chaturmukha. No patient should take any medicine of his or her own. Abhyanga, Dhanvantaram Taila, synchron massage. Massage with the 2 people simultaneously from right and left side. When I visit 20 years, America, Switzerland, Italy, Germany, Spain, 1994 to 2014, I have done all these treatments. I have trained to my students or their therapists in Spain. Synchron massage, very popular. Shirodhara, very popular in Europe. Kshiravala oil. Kaya sek, pouring of the oil on the whole body. Shali Shashtika Pindasved. Then you can take all these treatments by nearby hospitals of Ayurveda or the Vaidya, or you can mail me and I will give you the answer. Anuvasana Basti, that is oil enema, Dhanvantaram Tail 8 times, Niruha Basti, Mustadi Yapana Basti. Mustadi Yapana Basti, and Nasya is always there whenever there is a problem of nervous system or the brain. So you can see MND Ayurvedic treatments, massage is going on. This is Kaya Sek, Pidichil, pouring of the oil on the whole body. Then Shirodhara, can you see Shirodhara? This is the Nasya. Other medicines, Suvarna Samir Pannagaras. Samir means Vatadosh. Samir Pannagaras, capsule palsy neuron, Ekanga Viraras, Dhanvantaram Tail 101. This is for internal use. Remember, Dhanvantaram Tail for external, Dhanvantari Tail for internal. Two medicines are separate. Check it out first. So 101 is the name, 10 drops BD. Purna Chandroderas Makara Dhvaja Ashtavarga Kashaya Balarishta Dhanvan Dhanada Nayanadi Kashaya. I know pronunciation is difficult. Write down Dhanada Nayanadi Kashaya. Dhanada Nayanadi Kashaya. Kashaya is a kvat. Kashaya is a decoction. Then Bhattadarvyadi Kashaya. Chavanaprash, Shatavari Ghat, and Tapyadi Rohavati. Can you see Suvarna Samir Pannak of Baidyanath, Pasiniran from the Phytopharma company? This is Dhanvantaram 101 soft gel capsules. Can you see? For internal use. Sahacharadi 21 capsules, Vaidyaratnam for internal use. Baidyanath Ekanga Vidrasa. Kshirabala 101 Avarti soft gel capsule for internal use. Yeah, our Maharashtrian people many times they don't know. So if the Maharashtrian students are seeing this video, please note this. You don't know these tablets, soft gel capsules, but they are available from South Indian companies and they are excellent. Please take it from me. Then Abraka Basma capsules. Don't get shocked. Ayurvedic students, Ayurvedic doctors, please note this point. Capsules are available from Arya Vaidya Shala Kottakal. Bhasma capsules are very rare. No company is forming Bhasma capsules. Very few. One of this company, Arya Vaidya Shala Kottakal. Don't forget this. Purna Chandrodayas. So MND, avoid fast food plus fast life is equal to fast death. Salt, sour and pungent food should be avoided. Prevention is better than cure. Avoid Vata Prakopak Ahar Vihar, physical and mental stress. Don't smoke, don't alcohol, no tobacco. Avoid non-vegetarian food. Rasayana for Majja Dhatu. Again printing mistake. Please give me 1 minute. I will also correct over here. Okay. Here saving the slide and again making it a bit for you. Yes. Rasayan for Majja Dhatu, brain, ghee, almonds, walnut, meditation, chanting of Om. Very important. Pranayam and Shirodhara for Mouse Dhatu, Abhyanga is very important. So my dear friend, this is all about Ayurvedic treatment for motor neuron disease. Any disease can be treated by Ahar, Vihar and Aushadhi. So dietary advice, lifestyle advice and medicines. Disclaimer. So all purpose of these videos are educational. So no self-medication is expected. Please cooperate by the patient. So I am very thankful for you. I again request to subscribe my YouTube channel. Thank you very much and take care. Okay, bye bye. Take care.